All right, everybody, Coach Mark here, and today what we are going to talk about is intermittent fasting. All right, I get this question all the time when I'm doing a nutrition consultation about what do I think about intermittent fasting. So I want to go over the basics behind intermittent fasting and what it is. So basically a beginner's guide. Okay, so what we're going to talk about today is the different methods that are used for intermittent fasting, how it affects the body, the health benefits that come along with intermittent fasting, who it might not be that great for, also some safety and side effects, and then of course if it's right for you, if it's something you should try. So for today, you're not going to need anything much more than a pad and a pen to take some notes and just listen along. All right, so first things first, what is intermittent fasting? Intermittent fasting is an eating pattern that cycles between periods of fasting and eating. It doesn't specify which foods you should eat, but rather when you should eat them. In respect, it's not a diet in the conventional sense, but more accurately described as an eating pattern. Common intermittent fasting methods involve daily 16-hour fasts or fasting for 24 hours twice per week. Fasting has been a practice throughout human evolution. In fact, ancient hunter-gatherers didn't have supermarkets, refrigerators, or food available year-round. Sometimes they couldn't find anything to eat. So as a result, humans evolved to be able to function without food for an extended period of time. In fact, fasting from time to time is more natural than always eating 3 to 4 or more meals per day. Fasting is also done for religious or spiritual reasons. All right, let's talk about some of the different popular methods that are out there when it comes to intermittent fasting. So there are several different ways of doing intermittent fasting, all of which involve splitting the day or week into eating and fasting periods. During the fasting periods, you eat either very little or nothing at all. These are the most popular methods. First one is the 16-8 method, also called the Lean Gains Protocol. It involves skipping breakfast and restricting your daily eating period to 8 hours, such as a 1 to 9 p.m. window. Then you fast for 16 hours in between. Then there's the eat to stop method. This involves fasting for 24 hours once or twice a week, for example, by not eating from dinner one day until dinner the next day. Then finally, we're going to talk about the 5-2 diet or method. With this method, you consume only 500 to 600 calories on 2 non-consecutive days of the week, but eat normal the other 5 days. By reducing your calorie intake, all of these methods should cause weight loss as long as you don't compensate by eating much more during the eating periods. Many people find that the 16-8 method to be the simplest, most sustainable, and easiest to stick to, and it's the most popular. All right, so now I want to dive into how intermittent fasting can affect your cells and your hormones. When you fast, several things happen in your body on the cellular level and molecular level. For example, your body adjusts hormone levels to make stored body fat more accessible. Your cells also initiate important repair processes and change the expression of genes. So what I'm going to do is go over some of the changes that occur in your body when you fast, especially to your hormones. First one we're going to start with is human growth hormone, or HGH. The levels of growth hormone skyrocket, increasing as much as 5-fold. This has benefits for fat loss and muscle gain, to name a few. Then with insulin, your insulin sensitivity improves and levels of insulin drop dramatically. Lower insulin levels, by the way, can make stored body fat more accessible. And then of course you have cellular repair. When fasted, your cells initiate cellular repair processes. This includes autophagy, where cells digest and remove old and dysfunctional proteins that build up inside basically other cells. And then finally, you have gene expression. So there are changes in the function of genes related to longevity and protection against disease. These changes in hormone levels, cell function, and gene expression are responsible for the health benefits of intermittent fasting. All right, so what are some of the health benefits of intermittent fasting? Many studies have been done on intermittent fasting in both animals and humans. These studies have been shown that it can have powerful benefits for weight control and the health of your body and brain. It may even help you live longer. So I'm going to go over some of the main health benefits with intermittent fasting. First one, obviously, we've talked about this before, is weight loss. And as mentioned above, intermittent fasting can help you lose weight and belly fat without having to consciously restrict calories. Again, we talked about insulin resistance. Intermittent fasting can reduce insulin resistance, lowering blood sugar by 3 to 6% and fasting insulin levels by 20 to 31%, which will protect against type 2 diabetes. And we all know this word, inflammation. Some studies show reductions in markers of inflammation, a key driver of many chronic diseases. And then heart health. Intermittent fasting may reduce bad LDL cholesterol, blood triglycerides, inflammatory markers, blood sugar, and insulin resistance, all risk factors for heart disease. And we've all heard this, cancer, right? Animal studies suggest that intermittent fasting may prevent cancer. Also, brain health. Intermittent fasting increases the brain hormone BDNF and may aid the growth of new nerve cells. It may also protect against Alzheimer's disease. And then also anti-aging. Intermittent fasting can extend lifespan in rats. Studies show that fasted rats live 36 to 83% longer. Just keep in mind that research is still in its early stages, and many of the studies were small, short-term, or conducted basically with animals, but many questions have yet to be answered in higher quality human studies. So these are some of the benefits that you might get from intermittent fasting done through some studies. All right, well, who should be careful or avoid it? Two different reasons. One, if you're underweight, or you have a history of eating disorders, you should not fast without consulting with a health professional first. In these cases, it can be downright harmful, but that's basically it. All right, let's talk some safety and side effects. So, of course, the most obvious side effect that you're going to get from intermittent fasting is hunger. Hunger is the main side effect of intermittent fasting, right? For more obvious reasons. But you may also feel weak and your brain may not perform as well as basically what you're used to. But this may only be temporary, as it can take some time for your body to adapt and adjust to the new meal schedule that you've basically put yourself on. However, if you have a medical condition, you should consult with your doctor before trying intermittent fasting. This is really important for a number of many reasons. I'm going to go through them real quick. So the first one basically being is if you have diabetes, have problems with blood sugar regulation, have low blood pressure, take medications, are underweight, have a history of eating disorders, if you're a woman who is trying to conceive, if you're a woman with a history of amenorrhea, if you are pregnant or breastfeeding, those would be some of the other things that you would probably want to consult with your physician first prior to starting any intermittent fasting protocols. All right, let's go over some frequently asked questions. First one, can I drink liquids during the fast? Yes, water, coffee, tea, and other non-caloric beverages are fine. Do not add sugar to your coffee. Small amounts of milk or cream may be okay. Coffee can be particularly beneficial during a fast as it can blunt hunger, right? The caffeine in the coffee helps basically settle down your appetite, and it acts as, like I said, an appetite suppressant. Another question. Isn't it unhealthy to skip breakfast? No. The problem is that most stereotypical breakfast skippers have unhealthy lifestyles. So if you make sure to eat healthy food for the rest of the day, then the practice is perfectly healthy. Can I take supplements while fasting? Yes. However, keep in mind that some supplements like fat-soluble vitamins may work better when taken with meals. Can I work out while fasted? Yes. Fasted workouts are fine. Some people recommend taking branched-chain amino acids, or BCAAs, before any type of fasted workout. Will fasting cause muscle loss? Generally speaking, all weight loss methods can cause some sort of muscle loss, which is why it's important to lift weights and keep your protein intake high. Will fasting slow down my metabolism? No. Older studies show that short-term fasts actually boost metabolism. However, longer fasts of 3 or more days can suppress your metabolism. And lastly, should kids fast? No. Allowing your children to fast is probably a bad idea. Should you try intermittent fasting? Intermittent fasting is not something that anyone needs to do. It's simply one of many lifestyle strategies that can improve your health. Eating real food, exercising, and taking care of your sleep are still the most important factors to focus on. If you don't like the idea of fasting, then you can safely ignore this video and continue to do what works for you. At the end of the day, there is no one-size-fits-all solution when it comes to nutrition. The best diet for you is the one that you can stick to in the long run. Intermittent fasting is great for some people, not others. The only way to find out which group you belong to is to just simply try it out. If you feel good when fasting and find it to be a sustainable way of eating, it can be a very powerful tool to lose weight and improve your health. All right, everybody, thank you very much for listening along to today's presentation on intermittent fasting. I hope that gave you some good insight whether or not this is something you want to try, something you've been thinking about trying. Maybe you've already done it and you didn't know some of the other methods that I mentioned. Nevertheless, if you're going to try intermittent fasting, make sure that it is something that you can be sustainable with and that you want to work with and it's good for you. If not, don't worry about it. Just make sure you're getting a good amount of calories for you as an individual per day and you'll be just fine. Anyway, again, my name is Coach Mark, and I will see you on the next video.